Hey, hi everybody. It's Rita at Gold Medical Jobs, and happy to be here on a Wednesday. And it's April 2nd. No, April Fools. It's April 1st. That was pretty bad. I didn't think of April Fools till this moment. And so I hope everybody's well. And I'm going to share, as I often do, a personal bit about this COVID officially 3 of my dear friends, all adults ranging in ages under 30 to 70. It's a family, part of a family, dear friends of mine, a husband and wife and 2 adult children. Oh boy, haven't been to the hair salon in a while, so a lot of gray today. But these 4 folks are positive for the COVID-19. They are home. They are going to telecommunicate with their healthcare providers. They are mostly asymptomatic at this point. And my friend had, the usual malaise, just tired and didn't feel great. And one of the young women, she has several adult daughters, but 2 of the adult daughters that spend a lot of time at her home had varying symptoms. One had much more stomach distress, but she is prone to that. The other one had mostly flu and cold symptoms and a lot of coughing and sneezing. And the husband, who's the eldest, had the fevers. My friend, 2 of the 4 lost their sense of smell. I mean, they couldn't smell cat food. And if any of you have smelled cat food, it has a pungent odor. So they couldn't smell the cat food. And my friend's unusual symptom, I think you've heard some symptoms about a feeling of drowning. We've certainly heard of the short of breath, the serious short of breath that have put a lot of people on respirators. She had the feeling as though you went swimming in the ocean and the salt water got into your nasal passages. So she had that odd feeling. Her nose wasn't dry. Her nose wasn't running. She didn't have the sniffles. She just felt that. And at any rate, it took 6 days for the results to come back, and they are positive. And the treatment is like for any cold and flu is a lot of rest, a lot of fluids and nourishment and rest. As far as the one who had the fever and the fevers keep returning, the jury's out on that. I don't know if there'll be some antibiotic medication for that. But, fresh air, rest, fluids. I know even though it's April, a lot of parts of the country are still pretty chilly. I don't know what it is here, but I've got the windows and doors open, so I'm going to guess we're close to 60. I'm in Southern California, so, we wear sweaters a lot because we're not accustomed to a lot of cold. But where's my weather? Yeah, it's 54. It feels like 60. It feels nice. But, of course, I do have a sweater on. So, see that? Touching my face. I'm going to have to go wash my hands again. But at any rate, what I want to say about that is that I am certainly concerned about my friends, and I love them dearly, and I'm doing a lot of praying for them for great outcomes. And so far, great outcomes. Nobody's short of breath. Nobody has to report to the hospital. They never even reported to the hospital. Why is my nose so itchy? Gonna get in a fight. They went they're on a borderline between New York and New Jersey, so they went to where they were told to go, and everything was done while they just drove by in a car by medical professionals, and that's how they provided their samples. I believe it was a swab, a throat swab. So, so the good news, what is wrong with this dog? Sit down. Sit down and relax. Sit. So the good news is, I think, from my personal perspective is that we're all self-isolating. We're staying home as much as possible. I haven't so much as pumped gas in the last week or so. My son-in-law, God bless him, he's the youngest one in the household. So he does the shopping with mask and gloves. He often brings in packages and leaves the boxes outside for 24 hours. And when he empties them, we have Clorox wipes by the front door. So he's helping us from the outside. You know, we're mostly home, cooking and cleaning and hanging out with our new baby, and just doing that. None of us are ill. None of us have been ill, and we're protecting ourselves and our neighbors by just staying home a lot and working from home and all of that. The good news about my friends, it's not good news, but it makes me think that they will develop antibodies. They don't feel as ill this week as they did last week. They still have some of those symptoms of not, smelling the cat, sense of smell is diminished or almost gone. And my one poor friend that has the fever. So, but they will develop antibodies is the goal, and hopefully recuperate. So I think most of us that are staying home and watching too much news and getting some fake news and getting a lot of accurate news, but we're all afraid of dying. We're staying home because we're afraid of dying. And I think we're going to find out that when we're able to, when all of us are tested at some point in the United States, we'll find out that many of us were positive and had either no symptoms at all or very mild symptoms. Interesting. I was itchy. My nose is itchy. I'm an allergic type person, and so I do get the sneezes and the sniffles from time to time, and it's seasonal allergies, and I use some over-the-counter stuff that I spray in my nose, and it usually clears up in a day or so, or, when the flowers grow or the grass gets cut or whatever, they go away. So I'm hoping that we learn good hygiene and good community hygiene and all of that. We learn some good practices, and that the fear diminishes as we see this for what it is. It's devastating. It's worldwide, yes, but most of us won't die. I mean, it's just, the whole thing is scary and tragic, but there are some upsides. So my upside today is not April Fool's, but the fact that my friends are sick, and I hope they're going to get better and prove some of what I'm saying is that a good number of people will contract it with or without symptoms, build up antibodies, and that can be good news for the rest of us. So I certainly don't wish anybody to get sick, and I wish they weren't, but I'm trying to see to the other side of that. Now, what are we all about at Gold Medical? We are, if you're a hospital, if you're a healthcare worker, if you're a nurse or a nurse aide or a respiratory therapist or a surgical tech or a doctor, if you're a clinic, if you're a recruiter for nurses and healthcare workers, if you're a doctor's office, if you're a surgical center, if you're a hospital, or if you're any of the following that are in my my heading for today, are you an LTC, a SNF, an LTAC, or an LTACH? Check Gold Medical first. Come to us first, because we are different. We are not like the job boards you may have seen in past. We're not that. We're not recruiters. We're not that. What we are is a first place to have a conversation, a first place for somebody seeking an employee to sign up, and a first place for a nurse or a healthcare worker to look to see who's hiring. You can find one another at Gold Medical Jobs and more. So keep checking our website. We're on Twitter and LinkedIn and YouTube. So we are there for you, and we're a little bit different. We hope you like us. And I will be here a lot talking about things that I think are of interest to healthcare workers and healthcare employees. So today I thought I'll take those terms and clarify them, because I've interchanged them. I've probably confused people when I've used them. So I'm going to break it down, okay? And then I will do a Q&A. I was doing that for a while, and then I kind of stopped doing that and was telling jokes. But I'll tell you my little pun for the day, okay? From my calendar. So the nurse says, "How's the new medication working out for you?" And the patient says, "Terrible. I'm nauseous all the time. I have headaches and I throw up a lot." The nurse says, "Oh, well, we'll talk to the doctor about stopping." Patient interrupts her. "No way. I just bought a 90-day supply and I don't want it to go to waste." How funny is that? How silly is that? Don't do that. If you're having side effects from your medicine, talk to your provider, because you probably need something else. Okay, so here we go. LTC is the acronym or the initials for long-term care. Under long-term care, you have rehab and SNF and home care. So long-term care is defined just by that, long-term care. It could mean a variety of things. Hence, I put it at the beginning, because it is nebulous. It's not clear. Long-term care could mean a variety of things. Okay, SNF, SNF, skilled nursing facility. Skilled nursing facility is generally a more residential facility. They will have community rooms often in a skilled nursing facility. They will have, oh, I forgot to turn my phone off. Sorry about that. Let's lower that. A lot of skilled nursing facilities will provide physical rehab, nursing care, all kinds of clinical, medical, and physical care, but not acute, okay? Not acute. You will not be there if you need a lot of long-term IV antibiotics. You will not be there if you need a respirator. You will get skilled nursing, which really is referring to under the heading of LVNs and LPNs provide good skilled nursing. So they will treat you with medication, they will treat your wounds, and so forth. So that's your skilled nursing facility. And very, very helpful to a lot of people for a variety of needs. The LTAC, the LTAC, and the LTACH are used interchangeably, and they stand for long-term acute care and long-term acute care hospital. They're different than a general hospital or a medical center or a trauma center in that there are different guidelines, okay? There are different guidelines by the state and the federal at every level, the community level and so forth, as to what is allotted to the insurance and the patient. So long-term acute is a key word there. Long-term acute care, LTAC, LTAC, we call it LTAC in the biz, and LTAC, LTACH, if you want to add the hospital at the end. What happens at the long-term care hospital is that patients often are acute. Their needs are pretty acute. They need a lot more clinical care, and oftentimes they are covered there and stay there for 20 to 30 days and then reevaluated. Maybe then they can go to a skilled nursing. Maybe then they can go to home care. Maybe then they can walk out the door. Well, that would be awesome. But the LTAC, oftentimes, I want to say, boy, I should have my stats before I start talking to you. But the prolonged acute care that patients receive at the LTAC often come in the form of a respirator and I wanted to say what the percentage of patients on a respirator. It's pretty high. I believe it's more than 50%. I'm going to look over here on my second computer and see if that pops up from any of my typically. I'm sorry, I don't have that handy. But long-term care facilities have a lot of patients on respirators and have trachs and need a lot of clinical care. And yes, that would come under the term acute when you need those things. And okay, we've defined all the acronyms. We've defined LTC, long-term care, a general heading, SNF, skilled nursing facility, LTAC, either spelled LTAC or LTACH, is the long-term acute care or the long-term acute care hospital. So they're all necessary. They're all places that I have worked and you may have worked, but I throw those terms around, and we all throw those terms around. And we were instructed a few years back to stop using initials, to spell everything out. And so I guess I haven't stretched enough today. I'm stretching here while I talk to you. So I just wanted to make sure that I don't confuse anybody, and that I will try to always say specifically what I'm talking about, whether it's an LTC or an LTAC. That can be confusing, just like all the initials we've used over the years, you know, for morphine and oxygen and everything, you know. As a matter of fact, that you will still study all those terms. But anytime there's any doubt, if you're transcribing doctor's orders or if you're communicating one-on-one with people, clarify, okay? Because morphine sulfate can be MS, morphine sulfate can be MOSO, or, you know, all kinds of chemical terms can come in there. MS can be multiple sclerosis. So if you're talking to somebody and you're taking care of clients and patients, clarify, because we throw those terms around and we think we're communicating and understanding one another. And I know that many people that I work with, at the end of their instruction or their communication, will say, does that make sense? Was that clear? Am I being clear? You know, they're not being rude. They're not being haughty. They're not being, you know, I know more than you know. They truly want to communicate clearly. And in this business, in healthcare and taking care of people's health, it's key. It's so key, so important. So I thought, I don't know why that topic came up in my head, but I thought I better discuss it. And we could probably discuss that ad nauseum about almost every medicine and every treatment that we do. I'll tell you a little clinical occurrence that happened years ago. And I don't know if that's still in practice. Now, it wasn't that many years ago, so imagine it is. There's a couple of meds when you're working in an acute setting that you always have two sets of eyes on. One is insulin and one is heparin, okay? Whether you're giving it IV, whether you're giving it sub-Q, however you're giving it, well, they don't come in tablet form, so it would be one or the other, right? It would be sub-Q, it would be intravenous. That you always have two professionals, two RNs, or a doctor and an RN, double check the administration of those, because there's a huge difference between 1 unit, 10 units, 100 units, right? Huge. So you want to give the right dosage, and it's very important. One is an anticoagulant, one is blood sugar control, your insulin for blood sugar control, your heparin for your blood thinning. So I was holding up a vial, took it out of the patient's drawer, had another RN standing right next to me. I said, I'm going to give 5,000 units of this heparin. And she said, okay. And I drew it up in my little syringe. And she looked and we said, yep, that's right. It was on the right line. And so that was 1, 2. And then back to me as I pulled the syringe out of the vial, it was Decadron. It was not heparin at all. And I think it was heparin, not insulin. I think it was heparin. Insulin, you know, we store that in the refrigerator, so it's a little different. I think this came right out of the drawer. It was right next to my little vial of heparin, exactly the same size. Drew it up, got clarification from my second person, and then in my third look at that vial, I realized it was the wrong med. Thank God I didn't give it to the patient. So I went to that nurse who had already walked away, and I said, oh, come here just a minute. I just want to, it wasn't heparin. Can you come back? Can we do it again? And yeah, you know, that's why we do that, so many checks with our meds. All right. So I promised you a little, oh, here it is. So we'll do our Q&A. We haven't done it in a while. And so personal protective equipment, right? Personal protective equipment. We've all been using it for a while. It's been in the headlines, right? The shortage on masks, the N95s and so forth. All my friends and colleagues that use those N95s, they are uncomfortable to wear for any length of time. A mask is one thing, but the N95 is icky, but necessary. Okay, so what is a PPE? What is personal protective equipment? Actually, not just healthcare workers, firefighters, people working in warehouses and working with chemicals. A lot of people are using personal protective equipment. I believe that I am transcribing that correctly. Hang on. I'm going to go to my other computer. PPE. Personal protective equipment. Yes, that's what it's called. PPE. Personal protective equipment. Okay, the definition is a device or appliance to be worn or held for protection against one or more health and or safety hazard. Okay, so now here's the question. Which of the following, I'm going to give you 10 items that are probably personal protective equipment. There's something in that one of the 10 that isn't defined as personal protective equipment yet. Okay, so the following are, all of the following except one are currently personal protective equipment. Gloves, face shield, goggles, glasses, gowns, socks, shoe covers, masks, and respirators. Okay, I'll do it again. Gloves, face shield, goggles, glasses, gowns, head covers, socks, shoes, masks, and respirators. Which of those that I mentioned, of those 10 items, is not truly personal protective equipment? I'll wait a few secs. I'll wait a few seconds. And of course, there's various types. There's sterile gloves. There's clean gloves. There are purple gloves. There are clear gloves. Yeah, there are different kinds of goggles and masks and gowns. But I did mention 10, and one of them doesn't belong. Maybe your kids caught it if you're watching this with your children. So go through it again. The personal protective equipment that I mentioned are gloves, face shield, goggles, glasses, gowns, head covers, socks, shoe covers, masks, and respirators. Socks doesn't belong, although I'm sure somebody out there could make a special sock cover. But a lot of times what we do is we tuck our scrubs into our existing socks. We put our gowns on and our shoe covers on, and sometimes those shoe covers are actually booties or boots, depending if you're working in orthopedics or I'm looking at some pictures of personal protective equipment, and it goes beyond the healthcare realm, beyond the acute clinical setting, and it has a lot of things for construction workers and people that work with hazardous matters, all the firefighter. So there's shoes and boots and shoe covers and boot covers. So there's a variety. But as far as I know, socks are not personal protective equipment, but I like my socks. So socks are a good thing to have, but did not come under that heading of PPE. And there's another acronym, okay? So we talked a lot about that today, and I hope to talk to you soon. I hope to get my hair done before our next conversation. But thanks for tuning into Gold Medical Jobs. Stay well, be well, take care of yourself and others, and be positive. You know, we're going to find out down the road that as scary and disturbing as being part of this 2020 pandemic, whoever saw that coming? Boy, 2020 was so exciting when we were heading into it in the beginning of January. We were like, wow, 2020, we're living in 2020. Who knew that this was going to come with it? Bummer. I have a few other choice words, but I'm not going to use it on a video. But yeah, it's disturbing. But we're going to find out. We're building up antibodies. We know what to do. We're going to kick it, and our friends are going to kick it, and we'll be better prepared if this thing rears its ugly head again. And pray for your friends and the elderly and people that, how fortunate am I to live in my home with my daughter and her husband and this gorgeous new baby and my dogs, you know, and have some space. You know, we're not stuck in a one-room apartment. We have space and sunshine. I mean, I have so many things to be grateful for. My friend who's tested positive with her husband and her 2 adult daughters, they have lots of space. They have this beautiful deck, and they can get fresh air. They don't have the warmth that we have in Southern California. And as far as I know right now, the virus doesn't care if it's hot or cold. I don't think so. But at any rate, my good friends, physical, medical, we can help. I think it's a first stop for people in the healthcare business, people who are seeking their next best job, people who are seeking their next best employee. Stop by and see us first, okay? Thank you so much. I will check in with you again, and April Fools! Oh, it's taking a while to turn off. What's going on? I'm not sure.